Welcome back to another high-yield episode of the Dr. Stem Cell Clinical Revision Podcast. I'm Andrew, your co-host for today's medical board review session.
And I'm Ava. We are absolutely thrilled to have you with us as we break down another high-yield clinical vignette for NEET PG, FMGE, and INI-CET preparation. Remember, doctors, active recall and spaced repetition are your best weapons to conquer these exams.
That's right, Ava. Today we are tackling an essential question from the microbiology board, focusing specifically on the high-yield topic of gram-negative pathogens. This question is inspired by the NEET PG 2020 PYQ exam, so pay close attention because these concepts tend to repeat frequently.
Let's jump straight into the clinical vignette. Here is the patient presentation. A 30-year-old ICU patient on mechanical ventilation develops fever, purulent sputum, and bilateral infiltrates. Sputum culture grows gram-negative bacilli that produce a blue-green pigment and have a grape-like odor. What is the organism?
Okay, let's carefully review the four options presented to us. Option A is A. Pseudomonas aeruginosa. Option B is B. Klebsiella pneumoniae. Option C is C. Escherichia coli. And option D is D. Acinetobacter baumannii.
Now, let's give our listeners a few seconds to think about the presentation. Look at the key clues in the vignette: the age, the onset of symptoms, and the specific diagnostic findings. What is your diagnosis, doctors?
All right, Ava, let's reveal the correct answer and dive into the breakdown. The correct option is option A. Let's start with a comprehensive explanation of why this option is correct.
Exactly, Andrew. The correct answer is indeed option A. Here is the detailed clinical rationale. Pseudomonas aeruginosa is an opportunistic gram-negative bacillus characterized by pyocyanin, blue-green pigment, production, grape-like sweet odor, oxidase positivity, and motility. This pathophysiological mechanism directly explains the clinical signs and laboratory findings we observed in our patient. It fits the presentation perfectly.
Excellent explanation, Ava. But as we know, to score highly on the exam, it's not enough to just know the right answer. We must also understand why the other options are incorrect. Let's systematically rule out the distractors. First, tell us about option B. B. Klebsiella pneumoniae.
That's a very common distractor, Andrew. Option B is incorrect because this condition presents differently. In exams, you'd expect to see distinct clinical signs or diagnostic results that are absent in our patient's presentation. So we can confidently rule this one out.
Perfect. Now, what about option C? C. Escherichia coli. Why is this not the correct choice?
Option C represents a different pathological process entirely. While it might share some overlapping symptoms like general weakness or inflammation, it does not match the specific laboratory or imaging parameters described in the vignette. Therefore, option C is incorrect.
Understood. And finally, let's address option D. D. Acinetobacter baumannii.
Option D is also wrong. This is usually associated with a different demographic or clinical timeline, and the key diagnostic hallmarks for this condition are completely missing in our patient. That rules out all three incorrect options.
That's a masterclass in distractor analysis, Ava. Now, to make sure this concept is locked into our memory for the long term, we have a custom study mnemonic. Today's mnemonic is titled Pseudomonas Features. Let's walk through it.
This is one of my favorite mnemonics, Andrew. To remember the key associations and diagnostic criteria for gram-negative pathogens, use this memory aid: Pigments Pyocyanin, blue-green, and Pyoverdine, fluorescent yellow, odor grape-like, tortilla-like, or sweet musty odor. Key toxins: exotoxin A, AD-pyribosylates EF2, similar to diphtheria. Let's repeat that so it sinks in: Pigments Pyocyanin, blue-green, and Pyoverdine, fluorescent yellow, odor grape-like, tortilla-like, or sweet musty odor. Key toxins: exotoxin A, AD-pyribosylates EF2, similar to diphtheria. Try to visualize this clinical association when you see this topic in the exam hall.
Visualizing mnemonics is a proven way to bypass exam anxiety. But wait, we also have to talk about the exam pitfall or the trap that examiners love to set. What is the common trap for gram-negative pathogens?
Examiners love to catch students off guard here, Andrew. The major trap to avoid is Klebsiella pneumoniae also causes ventilator-associated pneumonia, but is characterized by mucoid pink colonies on MAC conky agar, lactose fermenter, and lacks pyocyanin. Make sure you read the question stem carefully to distinguish between these closely related conditions. Don't fall for this classic trap.
That is a golden tip, Ava. Thank you for that detailed breakdown. Doctors, make sure to write that trap down in your revision notes.
Absolutely, Andrew. And that wraps up today's high-yield clinical review. Thank you for tuning in to the Dr. Stem Cell Clinical Revision Podcast.
Be sure to subscribe and follow our show on Spotify, Apple Podcasts, or Amazon Music. Share this episode with your fellow medical aspirants, and keep studying smart. We'll see you in the next episode.
Goodbye for now, doctors, and best of luck with your revision.